Good day, everyone. My name is Amalaya, and I'm a public health nurse with the Vulnerable Adults and Seniors team, FAST. And together with my colleague, Mary, I welcome you to our presentation on the work of the Vulnerable Adults and Seniors team, FAST team. VAST is a voluntary service that was developed to work with individuals, community support agencies, healthcare teams, and City of Toronto divisions to address the social determinants of health for vulnerable adults 50+ and seniors. This team is made up of 15 public health nurses, 1 health promotion consultant, and 1 manager. The team responds to all service requests citywide relating to vulnerable clients and seniors and supporting them to meet their needs. The mission of the Vulnerable Adults and Seniors team is to improve the health of adults and seniors with vulnerabilities and to reduce health inequities. The VAST team fulfills this mission through early identification of risk factors and implementation of a variety of interventions directed towards enhancing capacity and quality of life within a population health framework. The goals of the VAST team is to improve access and equity to health services for vulnerable adults and seniors. Also to improve service provision in Toronto for clients who are vulnerable, as well as to establish strong and effective linkages and partnerships with community agencies to facilitate timely and efficient service requests. So who is considered vulnerable really? A vulnerable adult or senior is an individual that is isolated, without social support, who is reclusive, with underlying medical problems, with mental health issues, posing a threat to themselves or others. Vulnerability is considered a social condition that arises out of diverse social factors such as isolation, lack of education, poverty, absence of citizenship, language barrier, mental health diagnosis, illness, developmental disability, addiction, homelessness, or housing instability, sometimes history of abuse, gender identity, and sexual orientation. So VAST nurses take action on the social determinants of health for their clients on a daily basis. Most of the clients we serve have little or no social support network. Some have low social economic status, some with minimal education, and some have comorbidities and sometimes mental health diagnosis. VAST work aligns with some of Toronto Public Health's strategic direction, one of which is to serve the public health needs of Toronto's diverse communities. This we do by ensuring that all public health services are accessible and identify key health interventions to address the needs of seniors. We strive to improve access and equity to health services for vulnerable adults and seniors, and to improve service provision in Toronto for clients who are vulnerable. Another strategic direction is to champion healthy public policy. And this we do by promoting actions that increase resilience to climate change impacts on health. We're involved in health education on extreme weather and cold weather, extreme weather involving both cold and hot weather, to decrease the incidence of heat-related illnesses and cold-related illnesses in seniors and adults. Another strategic direction is to anticipate and respond to emerging public health threats. VAST anticipate and respond to emerging public health threats by monitoring and identifying emerging public health threats, including health hazards and extreme weather. We also ensure that all public health response plans address the needs of vulnerable populations, with a goal to improve access to health and social services for vulnerable clients. The Vulnerable Adults and Seniors team promotes equity at all levels. At the individual level, VAST nurses conduct home visits, we engage in case management, and we link clients to appropriate services such as community care access centers, local community agencies, family doctors, community centers, and shelters. Often in hoarding situations, VAST nurses connect clients to agencies providing extreme cleaning services, such as VHA and Fresh Start. VAST nurses also advocate at the Landlord-Tenant Board for clients at risk of losing their housing due to hoarding, and make connections with legal aid clinics for ongoing support. VAST nurses also conduct monthly inspections to Type B lodging houses to ensure the residents are safe and that the property is maintained in accordance with lodging homes bylaw. Also at the individual level, VAST nurses are involved in hot weather response presentations. Toronto Public Health monitors the weather from May 15 to September 30 to determine when a heat alert or extreme heat alert should be called. The goal is to prevent heat-related illness and deaths due to hot weather. VAST nurses deliver presentations to groups and provide one-on-one health teaching to vulnerable clients at risk of heat-related illnesses. We also engage in educational outreach to select Toronto community housing buildings, where PHNs provide educational sessions and act as a liaison to receive service requests at Toronto community housing buildings. At the community level, VAST is involved with several networks and coalitions, such as the Caring Alliance, the Scarborough Elder Abuse Network, the Scarborough Advisory Council and Community Services, the Scarborough Homelessness Committee, the Hot Weather Response Committee, Hoarding Coalition, Solutions, Toronto Seniors Forum, Right to Health Coalition, Rights of Non-Status Women, and the Uninsured Clinic Network. VAST nurses volunteer and advocate at the Uninsured Clinic, which runs 2 nights per week from 5 p.m. to 9 p.m. The Uninsured Clinic is a volunteer health clinic in Scarborough area for people without health insurance. At the Uninsured Clinic, VAST nurses provide episodic care and referrals to other support services for clients with no status or health insurance. At the system level, VAST engages in collaborating work with CCEC and the local integration networks to help vulnerable clients navigate the rather complex health system. Another system level involvement we have is with the Toronto Public Service. The Toronto Public Library formed a partnership with Toronto Public Health and Streets to Homes to reach out and assist people who are homeless or have behaviors that suggest they will benefit from further support and assistance. The pilot outreach program includes a public health nurse who specializes in working with vulnerable populations and can provide on-site mental health services at the Toronto Reference Library and the Yorkville branch twice a week. The nurse connects with customers in order to build relationships and provide referral services to those in need. They work to increase the awareness, knowledge, communication, and capacity of Toronto Public Library staff to better deal with people who are experiencing difficulties. Streets to Home staff visit the library to assist people who are street involved and homeless find better housing. The ultimate goal of the pilot project is to increase positive health outcomes for people who are in need. Demographics on older adults and seniors shows that they are the fastest growing segment of the population, that they account for 14% of total population now, and by 2031, the number of older adults would have increased by 38%. 1 in 4 seniors live alone, and women account for 58% of those aged 65 and over. Statistics of mental health issues reveal that 1 in 5 Canadian adults will personally experience a mental illness during a 1-year period. In 1999, the rates among women were higher than among men of all age groups. Canadians between 45 and 64 years account for 1/4 of mental health hospitalizations. 35% of ODSP, Ontario Disability Support Program clients are noted to have a mental illness. So the two fastest growing 5-year age groups were 80 to 84 and 55 to 59-year-olds, and they grew by 30% and 25% respectively. Seniors, as a percentage of the total city population, increased from 13% in 2001 to 14.1% in 2006. According to projections by City Planning, between now and 2031, the number of seniors is expected to grow by 38%. Other demographics and poverty in the city shows that in 2011, poverty in Toronto region rose by 22%. More than 100,000 low-income families live in the city of Toronto. The widening income gap between Canada's richest and poorest is also a growing health gap. In May of 2011, City of Toronto, Ontario works caseloads have reached a new high of 6.1% higher than in 2010. Social assistance can no longer cover even the basic cost of nutritious food and shelter for families and single households in the city, forcing many to rely on food banks. Statistics show that 21% of persons with disabilities in Ontario live in poverty, and that Ontario is the province with the largest share of food bank recipients. It is also noteworthy to mention that Toronto Public Service has unique customers. 25% of its residents have a disability, 54% are foreign-born, and 30% live in poverty. The gap between Toronto's high and low-income neighborhoods is deepening, where over 1 million people live in neighborhoods in the Northwest and Northeast that have experienced more than a 20% decline in incomes since 1970 compared to the regional average. I will tell you a story now. In VAST, our work is driven by compassion. The heart of what we do is advocacy. And here is an example of why we do what we do. I once had a client by the name Susan. She's a 79-year-old, sweet Irish lady living alone in a Toronto community housing complex. The public health inspector and I made a visit to deal with a severe bedbug infestation. The minute we got in, we said to ourselves, wait here, there's another issue here. Susan couldn't even tell us her name. There was no food in her fridge. When we asked her if what she had for breakfast, she had no clue. The superintendent of the building reported that sometimes Susan wanders the streets and the cops bring her back home. It's winter. How could she go out without a coat? She's at risk of hypothermia, of elder abuse, and of course assault. We didn't want to wait till there was a crisis. We didn't want to wait until we see Susan lying half conscious on the street. So we called the non-emergency number of the police division unit in our area because we wanted her taken in for a psychiatric evaluation. We also called the hospital to give them a brief overview and to talk with a social worker in Emerge. But Susan was not seen by the psychogeriatric team. Not only was she not assessed, she was also discharged alone after 11 o'clock that night. She goes back to her apartment with no food, no jacket, no discharge plan. We were upset. A hospital is supposed to be the citadel of care. From that point on, it was all about advocacy. Toronto Community Housing's mental health liaison got involved. We wrote letters to the emergency physicians and the medical director of the hospital. They took her back in, and guess what? She was diagnosed with dementia and given 24-hour care in hospital with a personal support worker until they found a long-term care crisis placement for her. Why do we need to advocate? Because clients like Susan cannot advocate for themselves. In the vulnerable population, there are no families. there are no friends. So the vulnerable adults and seniors team nurses stand in that gap to connect clients, to speak on their behalf. That's what we do. So these pictures depict a situation that a vulnerable adults and seniors nurse could walk into. This could be a senior living alone with no relatives. This is a hardened situation that constitutes a fire hazard, an uninhabitable dwelling with no functional kitchen, bathroom, bedroom, or living room. This could be a home with severe bedbug and cockroach infestation, requiring pest control treatment, extreme cleaning, and ongoing site inspection and follow-up by a public health inspector and probably public health nurse. Some of our clients could be dealing with a range of mental health issues, such as depression, anxiety, bipolar disorder, or schizophrenia. This could be a client that is homeless, living on the street, not willing to be connected to a shelter or any other support service. This could be a senior experiencing neglect, elder abuse by family or caregivers or friends, which could include financial, physical, emotional, and sexual abuse. So we always think that why treat people without changing what really makes them sick? These are some quotes from some of our clients. Some will say, if it were not for the vast nurse, my mother might have died. Another client have said, thank you for giving me hope again. It's nice to know that there are people that care about me. So the vast nurses are making a difference, one client at a time. Thank you. Because if you want to still work with